The New York State Department of Health is excited to announce the next step in the continued evolution of the tools supporting effective care for children in our state. This short video was developed to support the work of care managers, their agencies, and everyone who provides coordination and service to children and families. The Child and Adolescent Needs and Strengths is an information integration tool for use across the multiple child-serving systems that address the needs and strengths of children, youth, and their families. The CANS New York has been revised based on Health Home Serving Children member utilization data and care manager experiences from across New York. The CANS New York 2.0 will be released within the Uniform Assessment System, the UAS, in late 2023. For the past 7 years, the CANS New York has served as a guide in planning for children and adolescents up until their 21st birthday. These are young people with behavioral needs, medical needs, developmental disabilities, child welfare needs, and juvenile justice involvement. The CANS New York 2.0 is an upgraded tool enhanced by data-driven quality improvements and by thorough review of stakeholder feedback, designed to strengthen care coordination efforts and better support the needs of children and families in New York. Starting in the fall of 2023, the CANS New York Technical Assistance Institute will provide training and support to system partners as they navigate changes to the tool and its companion decision support models. Launched in December 2016, the Health Home Serving Children program is an initiative designed through collaboration between the New York State Department of Health, its partners from across managed care organizations, children and their families, and other state agencies and stakeholders. Based on this collaboration, a customized version of the CANS New York was created with the intent to tailor the health home models to better serve all children. A decision model known as Acuity, supporting different levels of care management, was developed by the same stakeholders, with the plan to adjust the strategy once data and implementation experience became available. By 2022, enough data had been collected to reveal how the CANS New York and its decision models were working, and where those models could be improved. Although the initial Acuity model had 3 levels, low, medium, and high, it's important to note that any child deemed eligible for a health home has complex needs, so low and high are relative terms within the high-need population of children and families served. Since 2016, about 74,000 children between the ages of 6 and 21 have had at least one CANS New York assessment. 42,000 of them have had at least 5 CANS New York assessments. Of those, 15,000 were found to be eligible for Home and Community-Based Services, HCBS. The remaining 27,000 children have had at least 5 CANS New York assessments, but are not in HCBS. 10,000 of those children were determined to have high acuity. 12,000 had low acuity, and 5,000 had medium acuity. Among all children with high, medium, and low acuity, 2 things were clear. All had multiple needs, and the health home program was working. Children were improving over time. Remember, acuity ratings in this analysis are not indicators of health home eligibility. Health home eligibility is foundational and was met by all children in our sample. The acuity serves to define the intensity of support that children need from care management or care managers, not their eligibility. On the CANS New York, actionable ratings are items that are identified as impairing or impacting the child's functioning. They represent areas of need and require action to be taken. This image shows a visual representation mapping the CANS New York actionable ratings across items for each child, identified by color, to represent the current care management support model for children, showing low, medium, or high acuity. It's important to remember that each dot represents each child's CANS ratings across all of the items on the CANS New York tool for each child within the program. The middle cluster of overlapping dots shows us that the current model classifies the needs of most as the same. But we know that children are unique. Rarely do any 2 need the same thing. Some have more need, and some have less. The CANS New York 2.0's updated decision support model shows a more clearly defined middle. Now that we see all the data on children and families served, a more equitable model can be developed. For children ages 0 to 5, the image shows how different early childhood needs are from those of older children. For these younger children, the data showed a clear distinction between their early development needs and the complexity of their needs when combined with the needs of their caregivers. To deepen our understanding of this analysis, we conducted 308 case interviews with care managers. 155 children and families were designated as high acuity, 104 as low, and 49 as medium. However, the care management received appeared to be uniform. Analysis of the models that have been in place since 2016 shows us that providers within the Health Home program have been intervening with children and their families in ways unrelated to their unique assessed needs, regardless of acuity. The exception to this practice is with crisis intervention services, which showed substantial variability by child and family. Data analysis and interview feedback clearly showed that the CANS New York tool could do a better job of aligning the levels of support with identified needs and strengths. The CANS New York 2.0 will allow a more equitable distribution of resources within health homes to more accurately reflect the circumstances of children and families participating in the program. A significant program improvement in the CANS New York 2.0 will be a shift in language, replacing the term acuity with complexity, a word chosen to better describe the children and families served and the nature of our work. The levels of support within the new model of complexity are now termed standard, intensive, and complex for children ages 6 to 21. For ages 0 to 5, levels of complexity in the new model are low, early development, and complex. These revisions, fostered by data-driven quality improvements, build on the initial success of the Health Home program and will significantly increase our capacity to customize care and fortify support for the needs of children and families in New York.
The CANS New York Technical Assistance Institute team is ready to assist with any needs you may have related to the CANS New York 2.0. Coaches are available to help with certification, support, and use of the tool and practice, and to answer any questions you may have about changes in the CANS New York 2.0 at help@cansnyinstitute.org. The live training calendar, how-to instructions and tip sheets, recorded webinars, and a complete reference guide ready for download are all available on our website, www.cansnyinstitute.org.